Welcome, welcome everybody. Just a happy Tuesday, first day back for all of us, hopefully. And so I wanted to do a really nice live tonight, get you guys on your way to the next weekend. So I'm here to take any questions and also help you with any health concerns that you may have. So first thing that I wanted to ask all of you guys, what do you feel like you're in the mood? What do you think about tattoos and TCM? Well, traditional Chinese medicine is great. That's what I practice. And tattoos, I'm actually a fan of tattoos and piercings. So all good, all good. All right. What do you guys feel like doing today? Do you guys feel like doing some acupressure for anxiety, aches and pains, or weight loss? Where do you guys want to start off with tonight? I will definitely answer your questions, want to help you on your way. That's my goal. What do you guys? Okay, anxiety off the bat. What else do you feel like doing? And again, if you're a subscriber, it's the yellow star in the lower left-hand corner. On TikTok, you get top priority. Oh, a lot of people wanting anxiety tonight. All right. Okay, we've got some requests for back pain. I see Pam was on YouTube and then she logged off. So at least on Instagram, what are you guys feeling like? Aches and pains, anxiety, weight loss? What are we thinking? I'm gonna give it another minute and then advice from when doctors blame mental health and don't listen to you. You know, that's a really good one. That's a really good one. You know what I do? This is what I do. If I don't feel like a doctor's listening to me, I just simply say, I don't feel like you're listening to me. These are my concerns. And then I would list out your concerns. So if you have that experience, know when you go into an appointment what you want out of the appointment. So I would definitely just say, I don't think you're listening to me. I'm a little frustrated, and I would ask for specific things that you want from your doctor. And don't be afraid to get a second opinion. It's always nice to see your beautiful face and smile pop up on my feed. Oh, hey, braided Punjabi. Nice to see you tonight. All right, you guys. And we had somebody from Pam. I got a good night's sleep last night with, oh, yes. People are saying that they got good responses from yesterday. So I was on here. I'm sorry, you guys, that I want to be here on earlier, but busy at the hospital. You look so smart in the white suit thing. It's my white coat. All right, let's do some acupressure. Everybody put your phones down. And let's do this. Let's do a really nice protocol for anxiety. So let me ask you all this. What do you feel like doing tonight? Do you want to do fingers, hands, or you want to do face, or you want to do ear for anxiety? What do you guys feel like? Let me know in the chat, because I want to do things that you guys are going to do with. Let's see, hands. Will this work with? Yes, it can help you with OCD, because you know why? As the anxiety goes down, then you won't feel so anxious. So yes, hands, ear. Oh, a lot of ear tonight. Okay. All right. Let's do it. We're going to do, let's see, we're going to do 3 points on the ear to help you with anxiety. And let me show you on my ear. So this is actually the left ear. So you guys know the drill. You guys know the famous point, probably one of the most famous points is ear shen men. So we're going to do that. It's going to put you guys in a good mood. You're going to do a good job going to sleep. So let's do this on both sides. And it's this point. So basically how you find it, you guys know this, it's basically the top part of the ear. And we're going to go ahead and do this together. I'll keep track for us for a minute. So let's go ahead and do some ear shen men. If you're just joining us, we are doing a 3-point ear protocol to help with anxiety, because that's what you guys wanted to do. After we do anxiety, we are going to do aches and pains. So all good. Let's do this together. We're already done about 30 seconds, and we're going to do another 30 seconds. And while we do this, let's do some deep breathing. Deep breathing also calms the nerves. See, I'm already getting sleepy doing the ear points. So let's go ahead and do some deep breathing, you guys. I'm going to go ahead and take 4 breaths. Follow along with me, and we'll do the next ear point. Yes, fantastic. And if you can, try to breathe through the nose. When you're breathing through the nose, try to do it when you're sitting down or laying down. I've read some research and patients report back that when they do the nasal breathing, rapid, they feel a little dizzy. So just be sure to do it sitting down or laying down, and also to breathe from your abdomen, close your mouth, and it's going to really help you to filter out the oxygen and oxygenate the blood, and that's going to also calm the nerves. So really good thing that you can do while you're having anxiety. So if you're just joining us, we're going to do a 3-point ear protocol for anxiety. You can also get the ear seeds and put them on any of our products. You can go to the second link in the bio. So we just did this point. The next point we're going to do is the rim of the ear. This is a great point because I'll tell you why the rim of the ear works. You have Adam here, and Adam is actually superimposed on the rim of the ear. And so when you're actually massaging the rim of the ear like this, you are doing 3 different things. You are helping the entire body relax, and you're also, that downward motion is also grounding you so that you feel more grounded and also calmer. And then the other thing from the apex of the ear all the way down to the earlobe, it actually helps you to lower blood pressure. So this is actually a really good point for someone you know that is struggling with blood pressure issues, and it's affecting them and it's affecting their entire body. Now, I know when I have blood pressure concerns because I can literally feel the blood push against the arteries for me. So this is a great point to calm the nerves, to calm the mind. It works for the whole body, and on top of that, lower blood pressure. You guys know this with blood pressure concerns. You should definitely work with your doctor. Don't mess around, because I've seen things such as headaches and migraines and also vision issues that happen because of blood pressure. So let's do this together. This will really help you, and I love how this point feels, and it's super safe. You can do it on children. You can also do it if you're pregnant and you're struggling with blood pressure issues. So let's go ahead and massage the rim of the ear. I'll put my hair up so you guys can all see it. My hair's getting long, isn't it? All right, so we're going to go from the rim of the ear, and we're going to go all the way down to the earlobe. So let's do this for the next minute. Let's do this together. And if you're just joining us, welcome. We're doing a 3-point protocol for anxiety, and then we're going to do what I call acupuncture 1, 2, 3, and that's going to help you with all sorts of aches and pains. And of course, somebody's always going to ask a question about weight loss, and then we're going to see what you guys want to do tonight. I was on the doctor's office and my heart rate was going like 135 every single time I got to the doctor's to go like that. Yeah, it's called white coat hypertension. A lot of people feel that way. So next time you go to the doctor and you feel like you're going to have white coat hypertension, you know what you can do? Then you can massage the rim of the ear. It'll help you to calm down. Really good. Next point that I love so much is actually on the rim of the ear, and it's going to get a couple of points first: kidney, liver, and endocrine. Kidney, liver, and endocrine. So I like to do this point with an acupressure tool, like a little probe thing that we can do. So we're going to do this point, and it's basically, let me show you guys. I put my hair up. Ooh, I have a mole right on my ear. In some cultures, that means I'm going to live to 100. Don't really care to live to 100, but I guess I will. Exciting. So let's go ahead and do this on both ears. Oh God, that feels so good. So if you don't have an acupressure device, you can go to the second link in the bio for all the devices. We vet them with a company called Kosha. You can also just use the rim of your finger, not a problem, or you can use a pencil, but this feels really, really good. Yes. Okay, fantastic. The questions are coming in. Hang tight. So we're going to, this feels really, really good. So I want all of you guys to do this with me. Now, each point I want you guys to do for 2 minutes. We're just doing these points for a minute each because I want you guys to get a variety, and I want you to feel really good. And I want you to do this with me so you sleep really well. So that's going to be really, really good. Let's do the other ear, everybody. So if you just joined me, we did a 3-point protocol for anxiety, and I want to share with you the protocol, and we're going to move on to aches and pains. It's first day back for a lot of us at work, and I'm sure we're all struggling with a lot of different aches and pains. Okay, fantastic. So really good 3-point protocol. Lots of different ways to handle anxiety, lots of different ways. But this is a really nice protocol. You can do ear shen men, you can do the rim of the ear, and you can do kidney, liver, and endocrine, just the inner ear like that, both sides. Do it for a minute each. You're going to feel good. You can do this laying down in bed. It's going to help you fall asleep help you take away your worries and fall asleep. All right, let's move on to aches and pains. So there's lots of different types of aches and pains that I see, but I want to give you a protocol that you can do, and you can do for any types of aches and pains. And the beautiful thing about acupressure, acupuncture, is that it's based on a lot of different reflexology. So one point many of you have noticed can help a lot of different things. And I purposely do that because here I can't give you a treatment. Here I can only really demo with my hands and my face and my ear, right? So I want to talk to you about where I see most of the aches and pains. And from that, I want to give you a simple protocol that you can always be like, what did she say? What did my acupuncturist friend on TikTok or YouTube say? So here we have Adam. So this is what I see in clinic a lot. I see a lot of frontal headaches. I see a lot of vertex headaches. I see a lot of temporal headaches. I see a lot of occipital headaches. I see a lot of temple headaches. I also see TMJ discomfort right here at this joint. I also see jaw pain. This is some of the things I see. Also, you have 4 sets of sinus cavities. I know sinuses are a problem. I struggle with it. It causes a lot of facial pain, and it's no fun for anybody. But sinuses, you have frontal sinuses, you have maxillary sinuses, and you actually have ethmoid and sphenoid sinuses. And a lot of time with sinuses, they are cavities. They were actually there to prevent bugs from going into our skull, but we don't need that. We don't live in caves anymore, right? So these acupressure points will move out the debris. So that's what I see a lot of in clinic. Let me show you what I see a lot of in back pain, and then we're going to go through all the different points you can do. I see a lot of occipital headaches. I see a lot of neck pain. I also see a lot of trap pain, a lot of shoulder blade pain. I also see pain on the spine, whether it's cervical, thoracic, or lower lumbar. And then the sciatic nerve pretty much exits L4, L5, goes down the back of the legs. It can also go on the side of the legs and also the front of the legs, and it can also go to the feet. So I see a lot of aches and pains such as this. So what I want you guys to do, as long as you're not pregnant, no hand or foot points if you're pregnant. It's too stimulating because the mirror image is of the uterus, and I don't want to bring blood flow to the uterus, especially when you're pregnant, because it's going to cause contractions. So as long as you're not pregnant, we're going to do 3-point protocol, and I want you to remember this protocol. It's called acupuncture 1, 2, 3, acupressure 1, 2, 3. So as long as you're not pregnant, you can use this for any sorts of aches and pains, and just get in the habit of doing this. You're going to feel good because it's good for weight loss. It's also good for period cramps. It's also good for women's health, and it's also good for pain. So let's do this together. We're going to start with this. Everybody put their phones down. Let's do this together. Just don't do it if you're pregnant. This is the first point. I'm going to keep track of time. Don't worry about it. Just relax and do this. This point right here is so good. Let me walk you through what this point can help you with. This point can help you with all sorts of jaw pain. This point can help you with occipital headaches. This point can help you with cervical neck pain. This point can help you with all sorts of back pain. This point, my tummy is rolling when I do this point. It can help you with constipation. It can help you with stomach pain. Also, all types of pain. You should just check in with your doctor. This can also help you with acid reflux, nausea, heartburn, bleeding gums, stomach ache, and also tooth pain. Also, it can help you with any type of mouth pain, even if you have an ulcer in the mouth. This point can also help you with sciatic pain, one of the best points for sciatica pain. This point can also help you with pain down the back of the legs, and it can also help you with medial foot pain. This is also a phenomenal point for metabolism, and I can feel my stomach burn and churn. And the reason why this is a great point for metabolism is this point can really clean out the intestines, whether it's a small intestine or a large intestine. And because the intestines get cleaned, then the food can more quickly metabolize because it doesn't get stuck. So great point overall to do. You're going to win with that point. Just can't do it if you're pregnant. Next point that I want to do, we actually have stickers today, is I got inspired by this point by doing Triple Warmer 3. Triple Warmer 3 or TW3 is pretty much right here. So you guys know, if you've been with me for a while, the best part of the metacarpals is between the bones, and that's the best points that I have clinically found. So I was totally inspired by this point. You can look it up, TW3, or you can also TB3. Sometimes it's referred to. So I like to do this point. Remember, I like to treat in zones, and the reason why I like to treat in zones is we have Adam here. Adam's actually represented in almost 10 different ways on the hand. Here, 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 and also here, 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 here. Adam is also represented by the entire finger, represents one torso as well. So if, I don't know if you guys sometimes watch Kathy Hill Tips, and one of her morning routines is doing this point. Now, this is a phenomenal point because it actually accesses almost 20 images of the torso, so it can help you from head to toe. I just don't like my ladies who are pregnant to do the hand points because it can be really stimulating, and we don't want unnecessary contractions. So the next point that I want you to do is this point. This is a great point. Let me walk you through the indications of this point. This point is this point is a great point if you're feeling inflamed because it accesses so many different mirror images of the entire body. This is a great point if you're just feeling, sometimes you might have eaten something and it didn't sit well with you and you feel swollen, or you feel like you're trying to lose weight and you can't because you're swollen. Well, this is a great point because this point can actually help transform circulation and phlegm throughout the body. So it's a great point for inflammation. It's also a great point for water weight. This is also a really good point for stomach. I can feel my tummy. And then this is also a really good point for lateral headaches, tinnitus. This is also a really good point for trap pain. Also a really good point for shoulder blade pain. Also a really good point for sciatica down the side of the legs. This is also a really good point for foot pain. So another really good point that you can do. And how I like to do it is fist on top of fist, or you can do it like this. Hopefully that explains it. Next point we're going to do is spleen intestine 3. And actually I was inspired by 4 points. Let me show you the 3 points. Let me show you the 3 points, and then I'm actually going to walk you through and show you the indications so we can do it together. So acupuncture is on an alphanumeric system. So you have a point here, you have a point here, and you also have a point here. So that's how I see it, right? Well, it's not perfect, but it's where they say the yin and the yang side of the body meet together. So what we have is 3 points right here. And so what I like to do is, because you have a mirror image of the torso like this as well, what I like to do is do the points bilaterally. And so we are going to do the point together. And this, I'll tell you why. This is a great point for back of the head headaches. This is a great point for all sorts of back pain. This is also a really good point if you have diarrhea. This is a great point if you're wanting to lose weight, but you just don't feel like you're absorbing your food. So this is a great point because it accesses the spleen intestine, the small intestine, which is known for absorption. So this is a great point. This is also a great point for sacrum pain or coccyx pain or low back pain, or in fact any type of back pain. Also a great point for pain down the leg, whether it's from sciatica or not. This is also a great point for lateral foot pain. So another really good point. This point also helps me right here, helps me with the maxillary sinuses, and also can help me with jaw pain. So, when you are struggling with pain, as long as you're not pregnant, you don't know what to do, or you have a condition like fibromyalgia or lupus, where it's all over body pain, which is common, right? And fibromyalgia, pain moves. It's just the way it is. You can't put your finger on it. And it's very frustrating for both the patient and the practitioner to help treat it, right? So whenever you have that sort of thing, simple thing you can do is think of me and go 1, 2, 3. So again, 1, couple minutes, 2, couple minutes, 3, couple minutes. We're going to do it one more time. I really want you guys to remember this so it can help you. Again, 1, 2, 3. And that can be really great. Just can't do this point if you are pregnant. Okay, really good, really good. All right, you guys. So thanks for thinking about me. Yes. What do you guys want to do? Do you guys want to go through weight loss, or do you guys want to open it up for questions, or you guys want to do fertility? What do you guys feel like doing? And then we'll open it up for questions. What do you guys feel like doing? So do you want to, okay, weight loss. We have one person. Okay, let me just, okay, a bunch of weight loss. Okay, let's do this. Somebody came in for migraines and hormone. Let me answer those questions real quick. Um, so migraine, this is a great point as long as you're not pregnant. Menstrual cramps, this is also a great point because the uterus is right here. Oh, thank you so much, Jane. And all my social media money goes to the free clinic. We're actually going to release a documentary about the free clinic coming up on YouTube, and you should check out YouTube. There are pretty much 2 videos a day that are being released. I want to provide you guys with a library. And then also we had another question that was really good. So hormones, this point right here, triple warmer 3 is a really great hormone balance point. Just remember, you can't do the points if you, hand points if you're pregnant. So let's do weight loss. Let's do, what do you guys feel like doing? You want to do ear, you want to do hand, or you want to do face for weight loss? Can you guys let me know what you guys are feeling like tonight? So I can, okay, hand, I'm going to see. Okay, hands, ear, face. Let me just, okay, mostly hand. All right. So let's do a bunch of points for weight loss. So my only caveat on the hands, you guys know, is if you're pregnant, you can't do it. So let's not do hand points if you are pregnant. So first point we're going to do, you're going to feel your tummy burn and churn with this one. So everybody just do this point. This is, I love this point. Kathy from Health Tips was right. This is a good point. And then when I took a look at the mirror image, I was like, damn, she mirror imaged like 10 torsos on each hand. So it's like 20 images. This is a great point to do when you're laying in bed because you're just doing it. It's going to bring blood flow to the entire body. It's going to circulate. And let me tell you something. I asked you guys to do this for a couple of minutes. But if you can do this for like 20 minutes, it's going to move the blood all throughout the body. So that can really, really help you in many, many ways. So this is a great point for weight loss because the stomach is right here, the stomach is right here, and then you get 2 hands, and that's just going to really, really get the stomach to get going. So this is what I see in clinic that people struggle with. They struggle with metabolism, they struggle with cravings, they struggle with hormone balance. So this point right here just helps with metabolism. And again, if the colon or the intestines is stuck and you're constipated, you can't metabolize because the food is stuck, right? So this is a great point to get from the mouth to the anus to get working. All right. Next point we're going to do, and again, no hand points if you're pregnant, is this point. Let's do this one. This went viral for me. Oh, I was on BuzzFeed. I was on NBC. I was on Dr. Osh show. And then this was one of the things that happened because of this point. But all good, all good. Actually, my most viral video was actually about men's health, but all good. This one, I think, got me 9 million views at one point, but really, really good. This is a great point for metabolism. And you know what I love about this point, too, is not only does it great for metabolism, but it also helps you with the spine. Why is the spine important? The spine is important because all the dermatomes that innervate also innervate the organs. So if the organs are functioning better, your body is functioning better. And that's going to help you with weight loss. Great point for metabolism, great point for balancing out the entire GI tract, and great point for back pain. You really can't go wrong with this point, just can't do this point if you're pregnant. All right, next point we're going to do is triple warmer 3. So triple warmer 3, where's my dots? My dots. I'm going to have to get sticky dots. So this is the point, triple warmer 3. And so how you find the point, and it doesn't have to be perfect. You go from the web to the wrist, and then you bifurcate it. And then it's in the ditch between the 2 metacarpal bones. That's the juiciest points. Remember, the juiciest points are in the ditches. That's what you'll remember. So this point, you can just do this point like this. So let's do this point for just a minute. And this is a great hormone balance. So in Chinese medicine, 2 different meridians really balance out all the hormones. It's the triple warmer and the spleen meridian. So if you hear me say that, that can really help. What can I do to not lose much energy after eating and having to lie down at almost 7 months pregnant? Oh, okay. Shoot. All right, I'll try to come up with something that can help you. Hang with me, dear. So this is a great point for hormone balance. Really, really good point that you can do for hormone balance. You can just simply do it this way. You can simply do it this way, or you can do it this way. Just remember, for my ladies who are pregnant, I'm looking out for you. No hand points for you. No hand points for you. Okay, next point I want to do is for cravings. Because, okay, check this out. When we're stressed, we crave sweets and or salt or savory or sugar or whatnot. And the reason why is because they make us feel good, right? And they comfort us. So I want to try to find a system for all of you that when you are feeling stressed, and you can avoid going to salt, sugar, carbs, right? So this is my system. If you've been with me for a while, you'll know. There's a brilliant point in acupuncture, and I'm really sensitive to it. It is the hunger point. Now, when I do ear seeds on this, and if you need ear seeds, you can go to the second link in the bio. I've vetted the person doing the ear seeds. So they're a really good brand, and most of the products are on Amazon. So this is the hunger point. This is the point right where the ear attaches to the head. Ear attaches to the head. This is a great point for washing away the cravings when you are feeling like you've already eaten a really good meal within your window. I practice intermittent fasting, so this point can help. It's super strong on me, and a lot of patients can help curb your appetite. Also, lemon water really works to curbing away your appetite. So what I like to do, and we're actually going to do a YouTube on this, is I like to compare this point with On Mien. On Mien, if you've been with me, is on, we have Adam. On Mien is on the mastoid process. It's the medial inferior edge of the skull, which is the mastoid process right here. So you're going to find the tender spot behind the, ooh, that is tender. You're going to find the tender spot behind the ear. And in Chinese medicine, we want the tender spot. That's going to release the tension. So what you're going to do, you guys know this peace sign, you're going to grab cuff the ear like this. And you're going to massage this and be sure to get the tender spot behind the ear. What this does is that it's going to make you sleepy. So you don't eat carbs, you don't eat sugar, you don't eat the salt. And that's going to be good because I think a lot of you may not be getting 7 to 8 hours of sleep. And if you're able to get 7 to 8 hours sleep, which is what's recommended, minimum of 7 hours by PubMed research, then it's going to help you on your weight loss journey. So really, really good stuff that you can do. So again, let's go through the points. This point for metabolism, this point for metabolism, this point for hormone balance, and this point right here to curb your appetite and to sleep well to help you on your weight loss journey. All right, really good stuff. So I'm going to open it up for questions. I'm going to go ahead and take my questions. And if you want a YouTube on a certain topic, just say YouTube, please, and I will go ahead and make a YouTube. And we already have like almost 900 videos on YouTube, so check us out. And all my social media money goes to the free clinic. And if you want to become a subscriber, yellow star on the lower left-hand corner on TikTok. We're going to enable membership on YouTube, but subscribers and members get top priority. So let's go ahead. And we got hair loss. Let's see, what other questions do we have? What can I do for severe eye inflammation, blood pressure? Okay, a lot of good questions. What is the YouTube page name? Same name. It's just Empirical Grace Acupuncture. Why do I get burps while doing it's because it's moving. It's moving. That's why, dear. Let's see. Okay, what else? Allergies. Okay, what else are we doing? Oh, okay. All right. Okay. All right, let's go ahead and answer some questions. And then I don't have a moderator tonight, so excuse me that I don't. Okay, awesome. And if you're a subscriber, you get top priority. I don't have a moderator tonight, so if you need help answering questions, just say it again. Okay. 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 All right. All right, good number of questions. Let me go ahead and answer them. And then do check out our YouTubes. We're going to start getting in a place, probably hopefully next week, We're posting twice a day on all platforms, so you guys get that library of information. Let me go ahead and answer questions as best as I can. And if you're a subscriber, please, let me know in the chat, and I will do my best to answer your question first, because subscribers get top priority. You can become a subscriber with the yellow star on the lower left-hand corner, and all my social media money goes to Free Clinic, which we're going to release a documentary about in the coming week. Hair loss. So I actually had a bald spot. Oh, maybe the bald spot's coming back a little bit, but anyway, I had a bald spot right here. What I used is a couple of different things. I used a derm roller. You can get this. Oh, we actually have a hair and beauty section. I believe it's a couple links down, and then you have the derm roller here. So what you can do is do the derm roller for a couple of minutes each night, and that really helps. It's medically proven. It actually has a few little spikes. It's not painful, and they stimulate the hair follicle. You can also do rosemary water. You can pretty much get rosemary, and you can boil it, let it turn brown, let it cool, drain out the rosemary, put it in a spray bottle, and spray away. I did it at nighttime, and it really helped my bald spot. Also, you can do castor oil. You can also do almond oil and coconut oil. All good stuff. Check out the link in the bio. We gave a bunch of recommendations, and thank you for saying my bald spot looks okay. I really appreciate it. For blood pressure, there is a couple of teas you can do, but blood pressure, you go from the apex of the ear all the way down. Apex of the ear all the way down. Check out my YouTube. We just released something on blood pressure, so do check it out. And also, as long as you're not pregnant, you can actually massage right here, right below the knuckle, on both hands. And so if you're pregnant, you can do the rim of the ear. That's all good. And no hand points if you're pregnant, but you can also massage right here. This is where the heart is. And also, hibiscus tea and cinnamon tea are really good. If you're pregnant, consult with your doctor on how much hibiscus tea and cinnamon tea you can drink, but both are really good for hypertension. So again, for blood pressure, just work with your doctor. The teas, definitely check dosage with your doctor. Okay, eye discomfort. For vision, this, do work with your doctor on vision, obviously, right? But this acupressure point is really, really good. It works well. I struggle with vision too. I actually wear glasses, and I'm getting older. The vision is getting worse, unfortunately. So this is a great point that you can do. It brings blood flow to the eyes, and actually the knuckles represent the eyes. So you can just acupress like that. So that can help with that. Okay, for allergies, what I would say for allergies, just consider this. There's an acupressure point. This point right here can really help with sinus and allergies. So basically, just like this point right here can really open up allergies and also sinusitis. Also, do consider maybe drinking a little bit of turmeric in your teas, just a pinch of turmeric and a couple cups of water. And turmeric is really anti-inflammatory. And if you can build the immune system, allergen is just a response to the immune system, so that can help. So a little turmeric, and then do consider this. Okay. All right, migraine. Just again, as long as you're not pregnant, this is a really good point for migraines. So really good stuff. And then restless leg, do get checked out for an iron deficiency. A lot of my gals with restless legs, they're a little short on iron. So do work with your doctor and see if there's an iron deficiency. So neck and shoulder, simple thing you can do is you can acupress like this, because this, actually, if you look at this, it has the mirror image of the shoulder. And this pretty much can replicate the shoulder. So if you acupress and then you rotate, you can see, you already heard a pop, right? And that can help. Actually, I feel really good doing this. So I work in hospital administration in addition to doing acupuncture. So you can see a lot of this on the monitor. But this and rotating can help with neck and shoulder discomfort because of that. So IBS, as long as you're not pregnant, this is a great point. It works for diarrhea and or constipation. Really intelligent point, diarrhea or constipation. So you can do this as long as you're not pregnant. And also bananas, actually, I found can be intelligent in regulating either diarrhea or constipation, but see how you do. And remember, you guys, do the points throughout the day. Get in the habit of doing it. You got to build the therapy into your system so it could be really good. Okay, I want to just do two other things, a couple other things, sorry. So if you're having trouble with quitting smoking, do work with your doctor because there are certain things that a doctor can do. But a couple points you can do is ear shen men, and then you can also do the rim of the ear, and you can also do the inner ear. So let me do it again. Smoking all throughout, you can get ear seeds. Just go to the second link in the bio, you'll see the ear seeds. So ear shen men, the inner circle, half circle, and you can also do the rim of the ear. Actually, we have a YouTube channel on it, so do check out the YouTube channel on this. So really good. All right, you guys, I have to get going in a minute, but let me leave you with this thought. So I will do my best to be on here earlier. Sorry, it's been really busy at the hospital that I work at. And so if you're struggling with anxiety, I want to give you a nice protocol that you can do. You can do it anytime. It's going to make you feel really good. Do consider going down the midline of the face. Do consider doing this point. Do consider also doing this point. Do also consider doing ear shen men right here. Ear shen men. Let me put the red dot so you guys can see it. So let me do this. It's really important to me that I give you tools that can help you. If you're struggling with anxiety, down the midline of the face. You can also do this point. You can also do this point, and we can also do this point. Also go to my YouTube channel. I walk you through a really simple protocol. I vary the protocols because the combination of points is a really good stimulus. So do consider checking out the YouTube channel. We're gonna have, by the end of November, we're gonna have a couple hundred new videos, and I really want those for this, you guys, so you have a reference point if you don't make the live. And also all my social media money goes to the free clinic, so binge away on YouTube. All right, you guys, love you all so much. I gotta run, do the acupressure, let you guys have a good night's rest, and I'll be back here tomorrow night, and check out our YouTube channel. Love you all. Bye. Oh, thank you. Thank you. Thank you. Thank you. Thank you for the love. Thank you. Thank you. Thank you. God bless you. Thank you.